Hi, I'm Mallory, and today I'm going to be demonstrating an assessment of a patient with a chest tube. A few supplies we want to make sure we are taking in with us when we go is an extra set of dressing in case he needs a dressing change when we assess him. We want to make sure we have some clean gloves, some hand sanitizer, a stethoscope, as well as a bottle of sterile water, a hemostat, and a sterile occlusive dressing in case something goes wrong while we're assessing the chest tube. So I'll go ahead and enter the patient's room. Hi, Mr. Smith. My name's Mallory. I'm going to be your student nurse today. I'm just going to do an assessment of you and your chest tube. Does that sound okay?
Absolutely.
Perfect. So I'll go ahead and wash my hands and provide for privacy. And Mr. Smith, can you give me your full name and date of birth, please?
Joseph Smith, 3/6/1965.
Thank you, Mr. Smith. That matches his ID band as well as the MAR. Perfect. So first thing we want to assess is making sure we have a current set of vitals. So in this case, my CNA has already grabbed some vitals for me, including a respiratory rate, which was 16. I also want to make sure I have a recent pulse ox. I can take a look at his monitor, assuming he's on continuous pulse ox, and grab that. We'll say it's 98%, which is also good. So Mr. Smith, first thing I want to do is just take a look at take a listen to your lungs. Is that okay?
Absolutely.
Perfect. So I'm just going to remove your gown here and take a listen to your lungs. And I just want you to take some deep breaths while I do that, okay?
Sure.
And just making sure we hit all those spots, listening for a full inspiration and expiration at each location. And then we'll go ahead and assist him to a sitting position. We can take a listen to the back. Okay. And the lung sounds clear, no adventitious breath sounds or anything like that. I'd also want to be taking a look at his chest while he's breathing, making sure that his chest is moving equally, that he's not having any pursed-lipped breathing, cyanosis, making sure that he's not doing abdominal breathing. For a lifespan consideration, if this were a patient under the age of 2, that would be a normal finding, but for an adult, it's not. And once we have assessed his lung sounds, and then we'll go ahead and take a look at his dressing. Before I do that, I want to get some gloves on, so I'm going to wash my hands again. And put on some clean gloves. Okay, and I'm just going to pull your gown down again, Mr. Smith, so I can take a look here. So first, upon inspection, we want to look for any signs of infection, any redness, swelling, anything that might indicate there's an infection at the insertion site, which we don't have anything here, so that's great. Also, Mr. Smith, are you having any pain or tenderness as I palpate around the insertion site?
Nope.
Okay, perfect. And then we also want to check for crepitus, so we would palpate up into the shoulders and possibly up into the neck to make sure that we're not finding any of that, which I do not hear, so that is also good. And I did forget to mention that while we're auscultating his lungs, we'd also want to check for any sounds of crepitus or any subcutaneous emphysema. But back to this inspection. So once we palpated and he's not having any pain or tenderness, no signs of infection, no crepitus, then we will go ahead and take a look at his chest tube and drainage system. So once we're looking at that, a couple of things we want to check out first right away is taking a look at his suction, making sure that that is at the prescribed amount, which this is not actually turned on, but it's good. We're also going to take a look at the tubing, making sure that it's patent, that there's no cracks or holes, taking a look at our connections, making sure they're secure. Everything looks good so far. We also want to take a look at the drainage collection chamber Also noting to make sure that it is below the level of the chest. So we want to take a look at the drainage. We want to measure how much drainage there is. We also want to mark that with name or initials, date and time, so that we can see how much it's increasing between assessments. Also noting the color of the drainage or any qualities that we can assess within the chamber. We also want to look at our water soil chamber, looking for any bubbling or tidling. In the first 24 hours, the bubbling can be normal. After that, it probably is not normal, and we'd want to make sure that there's not a leak. We can do that by clamping down. Using this to clamp down our tubing. If we do that and the bubbling continues, then we know that our leak is between our clamp and our chamber here. If it stops, then we know it's between here and the patient, and we can continue moving up until we locate the source of that leak. We also want to make sure there's no tangent loops in the tubing so that it's not hanging down, so the drainage isn't pooling or collecting anywhere. All right, and Mr. Smith, do you have any pain or discomfort with or without movement?
No, none at all.
Okay, good. And just a couple of things that we like you to do, because you do have a chest tube, is we want to encourage you to do as many of your coughing and deep breathing exercises as possible. We also want you to be repositioning every couple of hours. So either myself or the CNA will be in every couple of hours to make sure we get you repositioned so that you're not sitting still in one spot for too long. Does that sound okay?
Absolutely.
All right, wonderful. So lastly, I would just make sure that my patient doesn't need anything else, that the bed is low, call lights within reach, and I would go ahead and document. I'm gonna document date and time of the assessment, any abnormal findings, any interventions that we used, any teaching that I did, and I'll remove my gloves and wash my hands, and we're good to go.